morning, everybody. Senator, it's so good for us to just be chilling and not on not feeling that pressure. But let's kick things off then. Yep, Zen mode.
Exactly.
On.
We're all confident.
Okay, hi, Senator Portantino and team. It's so great to be here with you all from the location or one of the locations where y'all get the work done and make the changes. Thank y'all for taking the time to meet with us. I'm honored to be here with such brilliant people, literally the present change makers in the future of our communities, the ones breaking the cycle and bridging the disparities for those that are mostly affected by it. We're all here on behalf of the Los Angeles County Suicide Prevention Network, LASPN for short in the crowd, which is an ecosystem of mental health professionals, advocates, survivors, providers, researchers, etc., from a variety of organizations working together to decrease the number of suicides in LA County. This group in front of you is a part of the Youth Advisory Board, which is comprised of youth leaders from all over LA who are actively doing the work to both increase awareness of mental health as well as decrease the number of suicides. So let's get into intros. We can go around the room and have everyone introduce themselves so you can learn a little bit about them, what they do, and why suicide prevention is an issue that resonates with them. So Nick, we can start with you.
Hi, I'm Nicholas Bellison, and I'm 20 years old, and I'm a Cal State Long Beach student. I'm going into my senior year. I'm majoring in public health and minoring in microbiology. And suicide prevention is important to me because there's so much more that can be done and so many that don't have access to it. And I'm going to be a physician assistant, and I want to be able to do everything I can to support others. So that's why it's important to me. Yeah, thank you.
My name is Beatrice. I'm 19 years old, and suicide prevention is really important to me. My family has personally struggled with losing a family member to depression, and ever since then we've been advocates for mental health and therapy, and we just hope to see a change in how we as a society help those in need.
Thank you.
We're going to toss it over to Brittany.
Hi, my name is Brittany Flores. I'm a 21-year-old. I am a First Generation Latina. I did get my bachelor's in psychology. I have a certificate as well in child abuse and family violence. I will be attending Pepperdine this fall to complete my master's in psychology. Thank you.
Hello, my name's Nathan Lee. I'm a junior at Crescenta Valley High School in La Crescenta. I'm 17 years old. I'm also a youth advisor for Department of Public Health. I got my badge right here. And I have an interest in mental health and suicide prevention because one of the reasons is my parents both work for LA County Department of Mental Health. And so from a young age, I've been taught about its importance and the issues surrounding it. And in addition, as part of my work for the Youth Advisory Council for the Department of Public Health, I've been working on a passion project, and it's focused on teen mental health. And as I've been working with it, I've just continued to have a growing interest in it.
Thank you.
Amazing. And I'm Natalie. I'll be the moderator for this conversation. A little bit about me. I'm 26 years old. Salvadoreña, that's my sister. So very much the same boat and same thing. We lost a family member due to suicide. And I think that when you come from a family that migrated here due to war violence, specifically the Salvadorian Civil War, I think that it plays a huge role in the dynamic of the pain and just like the lack of knowledge for resources and all those things. And, we've seen it not just in our family, but in our surrounding communities. And I think everybody agrees on that note. But yeah, also I worked in social media production. I saw that you were in also film and production.
Yes,
and I was like, that was a fun fact.
Yeah, I came here from New Jersey to be in the film business, and they say politics is the entertainment business for ugly people. So I transitioned, from filmmaking to politics, and so both crazy worlds. And
absolutely,
you get to tell a story, and you get to get things done. So it's a good convergence of your passions.
I love that answer. Okay, and so obviously we all did our homework. We all know about you. And you don't need an introduction, but we're going to put you in the spotlight really quick. Okay, so let's do it.
That's my least favorite part of this. When people talk about me, that's the only thing that makes me uncomfortable.
Well, that's funny, because I'm going to do a super quick run through of your resume
good,
right now.
Good.
So Senator Portantino has an extensive background in public service, beginning with his role as a La Cañada Flint Ridge City Council member followed by his tenure in the California State Assembly, and now representing the 25th District in the California State Senate. Throughout your career, you've consistently uplifted mental health awareness, education, suicide prevention, among other critical issues, which are of particular relevance to young people in their teens and early 20s, and something we really care about, obviously. And so that's the short version and the online version. So we'd love to hear from you about why you do what you do, what got you into the work, and why you're so big on championing suicide prevention and mental health in your legislation.
Thank you, Natalie, for the question, and thank you for being at the forefront of this critical conversation. We knew pre-pandemic that young people were in crisis. Post-pandemic, it's even more concerning to all of us. And for me, I legislate, and the filter I use and why I got involved in politics is as a dad. And so the town that I lived in, the city council and the school district didn't get along, and I thought that was kind of silly. This is a technical term. I thought that was really dumb, that you have a whole bunch of folks moving here because they want a good education, and you have a government that isn't being responsive or being cooperative. And so that was why I ran for the first time for the city council. I was 38 years old. I had a 7-year-old daughter, and wanted to make sure that the town recognized the importance of young families, of education, and why it was important for a healthy society. And so that got me to run. And then lo and behold, I got elected, and then people started asking me for help. And that sort of drove home the responsibility of elected office. It's not about your name on the parking spot. It's what you do when you're in the parking spot. And when people who I knocked on their doors came to my house and said, help me, you help them. And so it really drove home how important this is. And, obviously, having two daughters a decade apart, I've also seen sort of a change in young people during that decade. And I think it's indicative of the crisis. Today's young people, and you are all exemplifying it, you care about your peers. You deeply care about your peers, more so than past generations of young people. You're engaged with each other. You look out for each other. You nurture each other. You worry about each other. That says a lot about all of you, but it also says a lot about the need that you sense in your peers, the trauma, the drama, the challenges that they're all going through. And I have a 21-year-old daughter, and I see how she cares about her roommates and her peers and the struggles that are on her college campus, and what she calls me about to say, hey, Dad, these things aren't right, or I'm concerned about this, and this is going to affect my roommate, or this is going to affect ADA or LGBT issues. You all sort of rally around each other, and so that makes me feel good, but it also inspires me to do more. And like many of you, my personal family story has somebody who dealt with mental health and didn't win that battle. My older brother committed suicide over a decade ago, and after that, people I saw every week who never mentioned a behavioral health or mental health challenge in their family, once I joined the club as a survivor, they all felt comfortable coming up and sharing their story about their aunt, their brother, their son, their nephew, their cousin who either had suicide or other issues in their lives. And it really, again, drove home just how prevalent this is and how little we talk about it. We'll go to a party and we'll talk about our cholesterol, our weight, our bike ride. We'll talk about other things, our sprained ankle, a sports injury that our son or daughter had. But we don't talk about the behavioral health challenges in our family. And we have to do that. We have to bring it out of the shadows. And so, going through it with a loved one really drove home, the need and then what we need to do going forward. So that's why I do all the policy in that area, and the lens I use as I do that.
Thank you for sharing that and for allowing us to, just create a space at this roundtable. I think that these issues, while critical, I think they can just be so personal at the same time, and there's no way around it other than to come out and show out with your experiences. And that's really the best, personally, I think that's one of the best ways that you can come out. And for you, it was the same thing where it was my daughter, and we are going through these changes. We're seeing that in our community. Let me step up to the plate, And so.
Well, my daughter makes sure that I step up to the plate.
Oh yeah, absolutely.
She's on me. She's a tireless advocate. So
it's a part of the new era, and I think it was really spot on when you said that this generation is very devoted to making sure that those changes happen and that they're enacted, and that
Well, as you experienced yourself, I mean, we who have learning disabilities have a unique perspective on this conversation. I was of the generation where we didn't have Ritalin, where we didn't have a lot of the things that young people have today. So I got in trouble a lot. And, the comment they used to write in my report card, he has ants in his pants. Because that's how they described it. Isn't that interesting? Ants in his pants. And one time I used to pull the elastic out of my socks and make little piles. And the teacher brought my mother in to show, look what he did, look at that. My mother went, okay, he did that. And I had a similar experience with my daughter in the first grade. She took balloons and string and wrapped it around a scissor. And the teacher went, look what she did. And I said, yeah, she made a sculpture.
It's beautiful.
Yeah, she made a sculpture. Channel that, don't stifle that. And so that's, to me, just sort of taking that personal experience that I have and then seeing what other folks have to go through. And undiagnosed ADHD means you weren't getting the sensitivity from your teachers. You weren't getting the time to take the test. They weren't understanding that, it's hard for you to sit in your chair for 5 hours straight. It's just hard, and it's unfortunate, but look at what you've done overcoming that. For me, I'm 62 years old, and the most stressful thing in the world is when we go to one of those retreats and somebody puts the pen in my hand and says, you be the scribe. I don't want anybody to see how poorly my penmanship is or how bad or if I transpose something. That still causes me stress today. I had to do something yesterday where I had to publicly write. And so I sort of take that and try to say, let's help kids deal with it. And if we know that they have a learning disability in the first grade, we can get them the help that they need. And it's better for the student, it's better for the system. There's a study out of Texas that has 70% of the inmates in a particular prison are dyslexic. We know that if we create readers, we're going to create successful people. And we know if we don't, we're going to have other challenges. Now, the other thing I love is I can listen to 7 conversations at the same time.
And have no problem.
And be in a room and know what everybody's talking about. And, I tell my staff I don't pay attention, but I know all. And, it's a great superpower. And I think you have to recognize the strength that you have that comes with this and then, be an advocate to let people know. So I think it's incumbent upon me to share my personal experience, to let people know that I actually have 3 learning disabilities. I'm ADHD, I'm dyslexic, and I have the one that no one ever heard of. I'm cross-dominant, which means I'm right-armed, right-legged, but left-eyed. And so that's another reason why I can't do a layup, because I don't know which leg to jump off of and why my penmanship is so bad. And carnival games I have to do as a lefty, not as a righty, because I'm left-eyed. And so no one ever heard of that one. But
that's so new to me. That's definitely a superpower.
Yeah, it's a superpower. So thank you. Yeah. You have it too.
Yeah, I think it's appreciating the randomness and the you're kind of just gonna jump around, and I think it's appreciating the way the ball flows. And not a lot of people have that, and it's true. It's listening to a bunch of different things at once and still knowing all of it. So
I tell people I get lost on purpose.
Yeah, it's fun.
Yeah.
I like seeing everything along the way. I think so. Yeah, that's so me.
It allows you to connect in different ways.
It does.
Honestly.
Yeah.
And my mom, she's a teacher at LAUSD for 30 years. So, but we will say though that school, you really do spend 90% of your time at school. It's a lot of hours in the day, right? And so because of that, it plays such a heavy influence when you don't have those things identified and when you don't have those things acknowledged. Experiences, interactions,
Well, just the bouncy chair. They found that ADHD kids do better if they have the bouncy chair versus the static chair. And school districts that understand who has those issues get those tools in place to help. I'm sorry, I didn't mean that.
Oh no, you're good. You're good. Yeah, imagine a school where we have bouncy chairs and the regular chairs, and you just switch off wherever feels more comfortable.
Right.
You're more honed in.
I don't know if that's a technical term, bouncy chair, but we just made.
I know which one you're talking about.
We just made a bouncy chair.
So at schools, times are ever changing, and curriculums should change with them. This isn't the 1920s where we just have to be like that all the time. So
you and I would have gotten in a lot of trouble.
Oh, for sure. Oh, you know what? Actually, in preschool, I was like, they had me at a private preschool and they had to expel me because I was like standing on top of the piano. But for me, I was just like that dirt. I was like, yeah, tell me something, you know? But here we are, right? In the same room now. But yeah, so let's get into the topic of education and teachers. And I want to invite Nathan to speak on that, who's doing great work to gauge issues with students. So Nathan, walk us through it.
So like I mentioned in my intro, I've been working on a project focused on student mental health at my school specifically. And as a part of that project, I had to conduct a lot of research, and the project's still going on, but at the beginning, when I was still doing most of the research, I conducted a survey at my school to gain a better understanding of what our student bodies at our school thought about mental health and specifically depression. And I ended up receiving 46 responses. And I realized that may be sort of a small sample size, but I do think there's a lot of trends that connect with what I also saw in my own personal experience that we can learn from, especially just as an exploratory study. For example, many students pointed to high academic stress and also sort of a lack of support from teachers who would just keep piling on the work as a catalyst for poor mental health. And that made sense to me as well, especially since even before I was going to my high school, I had heard of how they had high academic expectations and how it was competitive academically. And personally, I've also seen in designated times where teachers would be supposed to show mental health videos and things of that nature, they would skip it over for academic time because we were behind or to get ahead and things like that. So with that, my question for you is, I know you've been pushing Senate Bill 509, which is to provide mental health education and also teen behavior education to students and staff, and I believe the number was 75% of the staff. My question is just, what is your vision for what kind of effects would take place and what actions teachers should be taking with that education, especially since they seem to have such a large role in students' mental health?
Right. That's a great question. And again, thank you for doing what you're doing as a high school student, recognizing how important this conversation is. And I think 46 respondents is a good number because it shows people care and people, it's hard to get anybody to respond to anything. And so I think that's a good conversation that you started on campus. For me, it sort of comes back to a common sense thing. If somebody has a cut, you give them a Band-Aid, right? You don't just walk away and let them bleed. So if they're hurting inside, you want to get them help. You want to get them what they need to deal with what's happening inside, even if you don't see it. And the challenge becomes, you can see the wound if it's a physical wound, but if you're not trained to see what is going on inside somebody, then you're not aware to help them. And so what we're trying to do is say, let's just give 75% of people on a school campus the training they need to see what wounds people have inside. Not to provide the healthcare, but to direct them to get the services they need. And a father calls in every time we have a hearing and he talks about his 14-year-old daughter who turned in her journal as an English assignment, got an A on the assignment, and then 2 weeks later took her own life. And he said the warning signs of her suicide were in that journal. And he says, I'm not upset at the teacher for not seeing the warning signs because the teacher wasn't trained to see the warning signs. But prospectively, going forward, we should make sure that folks on a school campus are trained, and so we can get people to care. So that's the heart of what we're trying to do. And then going back to what we said earlier about young people being more nurturing around each other, we also want to make sure that we arm them with curriculum and knowledge and understanding. So as they advocate, they know how to advocate and they know what to advocate for. And so we're doing both of those things. We're trying to create more education and awareness within curriculum, but then with those folks who are on a campus to make sure that they are able to give out Band-Aids. So thank you.
Yeah, thank you.
Also, yes to Nathan and your 46 people doing the survey. 46 is a lot.
Everybody, as you said, everybody's worrying about their test and their the whatever extracurricular activity. And to have 46 kids take a survey, that's a good number.
Yeah, the initiative is what matters. you having that question and acting on it, and now you're here talking to state senators. So I think it's a good start. But taking it back to your questions, our teachers do need to be equipped because anxiety and other mental health struggles are prevalent, and they live in children at a young age. You know, it's not something that you like grow to learn. Like it can be born at any time, at any age. And it can lay heavy on the heart and how we go through life, right? Especially when we don't know how to deal with it or we don't have that guidance, can really affect us. So Brittany, I know you're super passionate about this topic. Can you tell us about your experience with this?
Yeah, so as you might have noticed from my introduction, there's a bit of background on my education and community work in mental health. And so you may wonder, how did this all start? And I can take you back to the exact date that change happened. It was November 16, 2016, and on that day was when I got diagnosed with generalized anxiety disorder. And at being just 15-year-olds trying to navigate high school, trying to navigate, being a teen, developing, it was very difficult. And as a former LAUSD student, I saw myself witness the lack of adequate mental health trainers, both my peers and both staff. And unfortunately, I struggled a lot to get the proper resources. And fast forward to even going into my undergrad in Cal State LA, trying to get services for therapy took months. And it was very heartbreaking to see that even in college. I felt like I was somewhat reliving high school. And so I'm here today to ask you, there was a question I'd like to ask you in regards to what is your role in creating a better relationship and communication between entities that support mental health services?
Well, it's a great question. Again, thank you for sort of taking your personal perspective and connection to this issue. And, you have a story to share, and you're not alone in sharing that story. And, giving other young people the confidence to share that story will help each other. And so thank you for that. As far as getting folks to work together, I think that's a key thing. We have so many folks in this space. We have nonprofit providers, we have traditional psychologists and psychiatrists and social workers, and we have this giant need. And for me, it's getting folks to work collaboratively, coming together and saying, and I use the public policy, the bills that I introduce, people come together to work on a specific path. And I think trying to get everybody to say, this is one struggle that we all share, is the message that I use. And so far we've been successful. We've built a broad coalition of advocates, parent advocates, teacher advocates, healthcare advocates, service providers, nonprofits, all working together to affect public policy, because we can change the policies, then we can change the big picture, take the macro view of it. So that's what we've been trying to do. And so far, we've had some struggles. Change is hard. I'm not going to sugarcoat it. We've had opposition. There are people who don't want to be trained, who don't want the institution to keep track, who don't want to know the problems. And, they feel the challenge is too great, and if we uncover it, that'll create too much of a burden. And I don't understand it, because we know if we find out the problem in first grade, it's a lot easier than in fifth grade. And we know if we help a second grader, that second grader is going to need less help in seventh grade. And the more in tune we are with each other, and the more love and care and nurturing we get for each other, the better we're all going to be. And so it has been a challenge, but with the coalition behind us, I think this year we're going to be successful.
Yeah, I think that's very important. And as being a first generation Latina in a low-income community, I can also see the barriers that we have, like language barriers.
Right.
We have the stigma, especially that in families. I think that's very hard, but I think it's also important for us as advocates to come in and step in and educate our communities. And I hope that I can continue to do that through my work. And going to Pepperdine is something I'm excited for, to become hopefully a clinical forensic psychologist. So I'm here for everything that's going to happen for the youth.
I'm going to change that word hopefully to you will.
Yeah.
You will be doing those things, because you're on a mission, you're on a path.
Yeah.
And thank you for doing that.
I had actually another question I'd like to ask you regarding to, my background in education, which was additionally, what is the state doing to build a mental health workforce pipeline and get youth connected to workforce training opportunities?
And that probably is one of the most important questions. So thank you for that, because we can change policies and we can say you're eligible for things, but if we don't have the workforce there, if we don't help the healthcare providers, and you have to wait 6 months, but you have an urgent, acute need, a lot could go wrong in that 6 months. And so we've recognized that problem several years ago. The state, from a macro perspective, has recognized that, and we've tried to put resources in the past 2 budget cycles. There's been about $4 billion invested into the development of a mental health care or healthcare provider workforce. We've tried to streamline the certificate process and tried to cut down without jeopardizing the expertise. We've tried to look at creative ways to get more people involved. Obviously, attracting more people into wanting to go into this field and making sure that the salaries are competitive with other aspects of society, because we're all human beings, and if I'm going to make $20,000 more to do something else per year, that's going to make part of my decision is going to be based on what's in the best interest of my family, and and as fortunately and unfortunately, folks who have experienced this tend to want to go into it. And as you've highlighted, there's a lot of low-income folks, there's a lot of immigrant families, there's a lot of folks with other challenges in their world, that economics play a big piece of that. And so if you're coming from that situation and you have an opportunity to make more money in the private sector, you're going to weigh those decisions. And so we have to make sure we have competitive salaries, we have to make sure we streamline the workforce, we have to make sure that we invest. And the other piece, California being as diverse as it is, we have to have the cultural sensitivity. We have to have, there's 88 languages spoken in LA County. We know from experience, when you interact with a public agency, it's a lot less stressful if the person behind the counter speaks your native language. It just makes you more at ease by having that. And so we have to make sure that not just recruit people into the field, but we recruit a diverse workforce, so the cultural sensitivities are there as well. And so it's the challenge, but we're trying both from a regulatory perspective and an investment perspective to tackle it.
Yeah, thank you for all your work. I mean, I think bilingual psychologists in general, there's a lack, and so definitely it's one step forward.
Right.
Yeah.
And even in education, dual language, it's great to have dual language classes, but if you don't have a Spanish teacher that knows calculus, you can't have calculus in Spanish, and so we have lofty goals. We now have to work on the implementation of those things.
Thank you for sharing your experience, Brittany. And yes to that, because that was me in college too with CAPS. But also, I love that you touched on creating this harmony and fusion with the youth and the work that directly impacts them. It's like that's what sets off the domino effect, right? Like if we can bring both of those fusions together, then we're on the right path. I think that the representation is great, but that lack of resources is just the issue at the forefront, right? And so I would like to pivot into another facet of mental health services, and I'd love for Nick, who's a student at Cal State Long Beach, to walk us through that from the lens of public health.
He's been very patient all morning. This is your time, Nick.
So, there is a clear inequity among every state, of course, and in every county. Some more than others. Residents are disproportionately uninsured. My question is there a way to be more preventative and inclusive with mental health services, as opposed to getting a diagnosis, like you said, like the 6 months thing? Is it an insurance issue? What kind of policy can go into that? Does someone need to experience that, the brink of suicide to be able to expedite them in, processes for getting mental health services? So that's my question for you.
Yeah, and clearly the system is set up, we have emergency rooms, that are there to deal with emergencies.
Right.
So no one ever says we need more emergency rooms. We've got that covered. But we need our less emergencies. And you have less emergencies when you get ahead of the situation, when you provide the access to a mental health provider as part of general insurance coverage. And over the last several years, my colleague from San Francisco has been very effective in changing insurance coverage law to make sure that more things are covered and more things get somebody into the care that they need. And that goes back to your question. It's great to say you're going to have access to it, but if we don't have the healthcare provider, then it becomes, it doesn't necessarily solve the problem. And so you're 100% correct. There's a huge social inequity throughout different counties, different places. Those who have access get better care. Those who don't. And, we've been trying to work on scope of practice issues and, greater use of nurse practitioners, greater use of having different certificated positions to be able to deal with some of these issues earlier on. And I think that over the long run, that's going to be effective. And we do have to make sure that those are reimbursable expenses, and that, again, there's an economic incentive for people to go into that field and take on those challenges. But it's all of the above that we have to just get better at. And obviously, what you're doing today is you're highlighting it from the need perspective and then asking the right probing questions to get us to do better.
My follow-up question to that is, what about the specific families who want to get care, and it's like they have to apply for Medi-Cal or Medicaid, and they're not able to because the process is so long and the funds aren't there, and et cetera, et cetera. So after we leave here today, what do you think about being more that with that whole process and expanding that for more people to have access and to have the availability of that resource? I know that it's a workforce thing too.
Well, you hit the nail on the head. It's one thing to say you're welcome to something, but if you don't know that you're welcome to that, you don't access it. And so that's where the cultural communication comes into place. That's where we have to, make sure that people know their rights, their privileges. We have to just get the word out, whether that's using multimedia or different language media, and TV and free media, and having the investing the resources to advertise in areas that drill down and get to that person who may not be on social media or may not be getting the LA Times. We have to do a better job to reach those folks, and we have to have the outreach professionals. Just like you do the census, you go door to door with the census. We have to be willing to put in those resources to get people into the system, and then the system has to have the capacity to deal with them. So it's both.
Okay, thank you for that.
But you're right. I mean, there are tons of people out there. I mean, I remember my mom, who was a single mom. There were things that she just didn't know when I went to college, how to navigate the system, and just she didn't go to college. And, she had 4 kids, and I think back of things that I didn't get, support systems that my mother just wasn't aware of to advocate for me at the time.
When I think of my future, of being a PA, I think about whether, if I have a patient that, they don't have insurance, they don't have this, they've applied for different programs and, Medi-Cal and things like that, and they're still waiting.
Right.
It's just the pairing them to the resource, being able to say, hey, I've seen this, in my child, or this is what's happening to me. Here's free therapy because this is going to impact your life, or, this is what long-term is going to look like for you. So having that funding and resource and connection to be able to access people who fall through the cracks.
Right. And not just having the resource, but they have to have the ability to sign up for it. Mm-hmm. They have to be able to access it. And that's, that is probably the biggest challenge, is getting out into the community as far down and around every corner to get people to apply. Because, California is a leader in many of these things.
Right.
But it's then connecting the folks to the resource that becomes a different challenge.
Thank you.
The way that these questions came up when we were deciding the core ones that we were gonna ask was all based on previous firsthand experiences or like the closeness in situations like Nick, I know, for example, like your question is heavily based on like seeing your friend go through this with his family. And because of that, you know, we've gone through this right there with him, and we want to be that solution and that helping hand to pull them out of these situations. And so you combine that with your work, which hasn't only helped raise awareness, but has also led to tangible changes and improvements in the lives of countless young people across California. So a lot of these topics directly impact the youth and those who are in their teens, early 20s, which is really such a critical stage in their lives. So I want to ask you, Senator, do the youth have any involvement in your decision-making processes when proposing mental health policies? And if so, can you tell us a little bit more about them?
So a couple things. A, we're here this morning having a conversation, and I would consider you all youth, if I'm allowed to say that. So I think that's important. B, you know, I am in high school campuses, college campuses constantly. I probably spend 50 to 75 days a year in a room full of young people asking direct questions. Just last week, I was in a high school economics class, and believe it or not, a lot of the questions were related to the economics of healthcare and same topics that you were raised. And then I was with another group of young people just the other day as well. So I'm out in the community a lot. Now, my favorite story is when I ran for re-election one time, a young kid came up to me and said, "You inspired me to run for office." And I said, "That's great." And I said, "But I didn't want to inspire you to run against me." I had spoke to his high school class, and that's where he got the idea to run for office. So then he challenged me. But so I try to be out and about. I also, you know, my family, my daughters are sort of part of my kitchen cabinet. My youngest in particular is a junior in college and very active on LGBT and ADA issues on our campus, and is unsolicited will text me and email me and call me every time she reads something out there that is of concern or battles that she's fighting. And so she's part of my kitchen cabinet. So I do reach out to her a lot, and I ask a lot of questions. And so I think out of that conversation, we get better decisions. I've had a number of interns who have suggested actual bills that have become law. One of my favorite bills that I did came from an intern who saw, you know, how we do the tattoo removal program for members of gangs who want to get their gang tattoos removed. We remove those tattoos for free. And my intern saw that women who were forced into trafficking or prostitution couldn't get their pimp's name removed for free because they weren't considered gang members. And the program only was applicable to gang members. And my intern came to me and said, "This is wrong. You know, why shouldn't she get it when he gets it?" And we actually put a bill in to change the protocols to allow the women to get their tattoos removed as well.
It's amazing.
And so that was brought to me specifically from an intern. So then it became state law. So I always ask the folks who come into my office, and we have a very robust internship program. We have about 15 interns every summer that work in our office, and I always sit them and say, "What ideas do you have?" You know, I can't have all the ideas. You know, I always say I want to sit next to people who are smarter than me, which is why I'm sitting with all of you today, so I can steal all your good ideas.
No, the youth are a force of nature.
Absolutely.
Truly. So, Senator, you've led pivotal initiatives and measures over the years, such as Senate Concurrent Resolution 26 back in 2017, Senate Bill 972, aka the Suicide Prevention Act in 2018, and SB 14 in 2021. So you've consistently pushed for increased investments in resources for mental health treatment and support, as well as early intervention programs to address the growing mental health crisis in our communities, but hopefully decreasing now, right, with the workforce that we're bringing. But the last question to wrap this all up for us is, what do you think are the biggest priorities in terms of suicide prevention?
Well, I think the biggest thing we can do is to be upfront about it, is to bring it out of the shadows, is to be comfortable sharing our personal perspective and letting people know that this is that behavioral health issues are just as important as a broken ankle. You just don't see it. And in many respects, when you have a broken ankle, you know if you put the cast on it, it heals in 8 weeks. right? With a behavioral health issue, you don't know that you're going to have a solution in 8 weeks. It's a much more ongoing situation. So I think the most important thing is to make sure people understand that behavioral health, mental health issues are real. It's not something that's made up. People like to say, well, society's gotten softer and, everybody just needs to buck up and, tough it out. That old notion of fuerte, and we have to dispel people of that. These are real scars inside of all of us. And I think if we share that, people will get it, because the more we talk to people, the more they can see someone else in their family. And I think that's the most important thing. The second thing is then to actually enact policies that respect that situation. Now, one of the things we did, which we didn't talk about earlier, is, in education code, mental health and behavioral health were not treated the same way. And so when you had your behavioral health issues, that was not considered an approved absence, but a broken ankle was. And so we changed state law that said behavioral health and mental health have to be treated the same way when it comes to schools. And what emphasized the need for the bill is I was having a meeting with a large editorial board from a major newspaper chain, and one of the prominent editors said to me, was I concerned that a parent would lie about a child facing a behavioral health struggle as an excuse? And I said, the fact that you would assume a parent would lie about a behavioral health issue but not over a cold, the fact that you would go right to that emphasizes why we need this bill, because you were buying into the stigma and the ignorance about the subject, And so that, to me, drove home why we needed it. So that was one change that we made. And I think, following up on that, being forthright, being open, having more folks in the media who tell, the governor talks about his dyslexia, that's a good thing. We need newscasters to say, what, I was off the air yesterday because I was, struggling with a bipolar issue, or, I had to get a family emergency. I mean, we need more people to share their personal stories so people who we all know and trust can get people to understand the struggles that every family has. And again, I go back to when after my brother's suicide, folks who I saw week in, week out for decades who never shared a personal experience then shared it with me once I was in the club. And so we just need more of that. I think that's the most important thing.
It's a silent struggle.
It's a silent struggle, right?
It is. And even you saying that, I'm like, the machismo, the way that it's so prevalent in like Latino communities, it's so true, and it's the same for Black and brown communities. Everybody just wants to keep that image, but that representation and that feeling seen, that feeling of
invincibility.
Yeah, like I'm not the only one, like this is actually very normalized. Like it plays a big role.
Right.
And like I don't know if you know who Nipsey Hussle is, but okay, so he has this like thing that he says, right?
It's 2 Chainz says I'm different. So don't sell my pop culture. Don't let the tie. Don't be prejudiced against my tie. All right, don't judge me. Come on.
So he has this slogan where he says the marathon continues, right? And I think that the work that we do, and even like us being in this room together, is the perfect example of that. Like this is not a sprint. Like the mental health stuff, everything, none of this is a sprint. Like we're definitely gonna have to keep doing the work, both you and both the youth as well, like the work that Nathan is doing, like the advocacy that Nick is bringing to the table, the experiences that Beatrice and Brittany have, like it's all a part of the marathon. So I want to like pass the mic on to anybody else as we're closing out. Like if you have any last thoughts that you want to leave here, because it's very much like work that requires advocacy, resources, money, representation, so many of those things. So I will leave it to y'all, the real voices, for any last words, any last mic drops.
You can go first.
I'll share like a story, and like I don't know if anything will let me just share. So like my friend Matthew, like both of his parents passed away when he was younger, and he had insurance through his parents, but when they passed away, the insurance company, like, he wasn't a part of that insurance anymore, and he applied for Medicaid and through Medi-Cal programs, and no progress, nothing. So he lives with, his guardians, but there's no insurance that's connected to him. And why I bring it up, because that's part of preventative care. So he's paying so much out of pocket through a single payer system, through Kaiser, right? And for example, he has that opportunity, but what about all the others that in similar situations that fall through the cracks? So with that said, I also want to bring up, what if, we we're in a community that teachers, part of their agenda was, hey, I don't know if anyone is going through something, but there's free therapy at so-and-so, and that's, backed up through policy, through funding, through that. So if there's someone in the classroom at school, what happens at home, that's harder, that's why we need to work in outreach and representation and stuff like that. But when kids are in school too, and just giving that extra resource and saying, I don't know if there's anyone in the class, but here's this and this. Not just, oh, here's a console, here's this and that. Like, actually, you can sign up today. It doesn't matter if you're, undocumented, whoever you are, you can still get that. And, because we see a lot of these shootings and stuff are students, in these schools. So what if that opportunity was given at a younger age and introduced to them, and what kind of policy and funding can go into that?
And one of the things we've fought for the last couple of years is to make sure that student wellness component is on every campus, because there's an inequity too. There are affluent communities that have a wellness drop-in center and have a social worker on staff, and then there are many schools that don't. And so what we've been trying to do is create that atmosphere of student wellness on every campus, and so a teacher can help shepherd a kid to where they need. And to go back to your insurance question, I know we probably want to end on a positive note, which I will, but I'm going to share a negative story. When my brother was dealing with his struggles, he was put on 3 14-day holds, and on day 14, 3 different times, he was let go. He didn't have insurance. So I always felt that if had he had insurance, they would have kept him in the hospital. But somehow he was cured on day 14 3 times, and then of course he wasn't. So that insurance barrier was definitely germane. I believe germane to his survival.
Definitely. Thank you for sharing that.
Yeah.
So what specifically do you think that,
Well, I think we have to make sure make universal health care. We have to expand the Affordable Care Act. We have to expand, our rights and privileges. We have to expand access. We have to say these things are covered expenses.
Yeah.
We have to do all that. And we need the healthcare providers to do it in a timely manner. So we have our challenges, but we know what the solutions are.
So when we look at policy, is there support behind passing bills?
There is. It's
soon?
particularly on the mental health component. Yeah, there's
Okay.
been a lot of progress, and there's more coming.
Okay, good. Thank you. Yeah.
The marathon. It's
Right.
the marathon,
Well,
right?
that was the positive thing I was you went Nipsey Hussle. I'm gonna go old school.
Okay.
So I'm gonna go back to Mother Teresa, which I
Okay.
knew you knew Mother Teresa. So Mother Teresa said, this is, we all want to make a difference, and I don't want anybody to put pressure on each other. But so Mother Teresa had a great saying. She said, when they tell me my efforts are but a drop in the ocean, I say, isn't the ocean better off for that drop? If we all just put a little drop, then it becomes a tidal wave, but we just put a little drop. So, not me, Mother Teresa.
Not you.
Well, thank you, Senator Portantino and the team. And thank you on behalf of LASPN for this engaging conversation with us. And we're definitely looking forward to more insightful and thought-provoking discussions with you and your team. And just know that the youth are always here.
Yeah.
They're present, and they are
And I hope
ready
you come
whenever you need
back.
them.
Hope
We
you
hope
all
so
come
too.
back.
I
Yeah.
hope so.
We'll come back if you'll have us.
Keep the
If you're buying, if
I'm
you're selling,
buying.
we're buying.
We'll keep the conversation going.
Great.
I want to hear the progress. Yeah.
Yeah.
Okay. Well, thank you so much.
Thank
Thank
you
you
for
so
having
much.
us so
Thank you.
much.